Hey, everybody. Welcome back to another episode of the Horse Geeks podcast, where we look at horses and riding from the inside out. Today, I have with me Stephanie Carter, FNTP. Is that correct?
Right.
Okay.
Yes.
And we're going to talk about ulcers in horses today. So, Stephanie is a very holistic based equine nutritionist. And we've done a couple of podcasts in the past. We did one on
Mhm.
basic nutrition, and I think we did the second one on, was it colic?
Meta No, it was
No,
equine
metabolic.
metabolic issues, and we actually did
Yes.
a third one on optimal digestion.
Oh, that's right. Yeah, because I
Yes.
haven't seen you in months, so it's like
I
kind of jogged my
know.
memory. But I have to tell you, my horse, who is now 30 years old, and at 28, she had major colic surgery. They
Mhm,
removed 5 lipomas, and
mhm,
she did well recovering from that. But she had been on, a senior diet for years. And when I did a
mhm,
little bit of research on the lipomas, there's some theory floating around out there that it can be an inflammatory response. And
mhm,
so then she had her teeth removed, which was more complicated. And then she had a second really bad colic just
mhm,
after, I think not long after you and I had first done the basic nutrition podcast. And
mhm.
so putting all that together, I switched her diet, and overnight it looked like she lost 100 pounds. I was like shocked that,
In a good way, lost 100 pounds.
well, she looked terrible, but her
Okay.
digestion cleared up immediately.
Okay.
And
Mhm,
so like even her manure went from cow patty quality back
mhm,
towards ball formation. And she's
mhm.
been on this diet now ever since, and I have not, knock on wood, had a single colic symptom. And so it's
Right.
really working for her, and she's
Mhm.
slowly put the weight back on. But my
Mm.
question to you is, can a horse like that rapid weight loss? It wasn't like she wasn't getting calories. She eats more than
Right.
any other horse in my barn. She has food
Mhm,
24/7 in front of her,
mhm,
high
mhm,
fat amounts in her
mhm,
diet.
mhm.
And could that be related to the inflammation? Like somehow that she looked better on the senior, she looked
Mhm.
worse on the all forage diet, but
Right.
her digestion and colic really cleared up on the all forage diet.
Mhm. So usually what I tell clients when they're switching from a conventional grain-based diet is that uh, it's very similar to, for example, if you've known anyone who's gone from eating your standard American diet, which is, very highly processed, lots of, high fructose corn syrup, carbohydrates, things like that. And then those people switch to doing something like keto, paleo, whole 30, one of those kind of, fad type diets.
Hmm.
Um, and it's an sort of an anti-inflammatory diet. They initially lose what we see visually as a ton of weight, but actually what they're losing is inflammation, because obesity isn't actually, it's excess adipose tissue, which is, yes, technically fat, but it's not, it's inflammation. The fat is there to protect the body from all the toxins and inflammatory things that it can't get rid of. So people will look puffier or, heavier, having lots of, excess adipose tissue or fat tissue, but it's really just a signal that there's inflammation in the body. And how much excess adipose tissue is there is how much inflammation is in the body. And it's the same thing for the horses. So when you go from something like a senior feed to the forage based diet, if in the beginning you're not feeding more calories or of the macronutrients than you were previously, a lot of times I'll see them lose what owners and trainers see as weight, but it's actually the inflammation that was in the body. So
No,
in the beginning you kind of have to overcompensate by feeding more of the forage based type
yes.
diet than you were of your conventional feed. But once the horse reestablishes what's called metabolic flexibility, they end up needing to be fed, much less than you do in the beginning.
Yeah,
Does that
that's
make
been
sense?
exactly my experience. And thank you for just taking a moment to talk about this because I figured we hadn't changed. She was getting tons of calories. I knew in the diet change, I wanted to make sure she had plenty of calories coming into it. And
Mhm.
the weight loss was sort of a sudden thing without changing, with only changing the diet, but not reducing the calorie intake
Mhm.
and not changing the work. And I went,
Mhm.
I was, I've owned this mare since she was born, and my heart broke thinking
Right.
all these years, that's what's been going on. And one of the things I had struggled with her for years is she's an Arabian with no desire to go forward, like
Right.
the
Mhm.
slowest horse on the planet. And
Mhm.
once she sort of had that physical appearance change, her body matched what was
Mhm.
happening in the training. And I got it. I was like, and it
Yeah.
absolutely, I mean, now she's putting on weight, she's looking great. And, but it's
Mhm.
like, it just really was a shock to the system. And I want to thank you because I thought I would lose her to colic. And that part, that's what made me stick with it as I go, her
Sure.
poops look great, even though she looks terrible.
Right. Well, and that's where I can give everyone all the information in the world. I could tell them, exactly what to feed as far as items or things like that. But unless we're usually when people switch from conventional to a forage based diet, I usually encourage them to still reach out to a nutritionist of some sort that is well versed in forage based, whether that's me or someone else. There aren't very many of us that are focusing just on forage based, but to get the volume right, because when I work with clients and I know they're coming off that conventional diet, I calculate the diet to compensate for that weight loss so that owners don't have that initial, heartbreak or panic where they're like, "Oh my gosh, my horse looks terrible. I can't do this."
Yeah.
Right? So sometimes it helps in the beginning if you're switching from conventional to forage to just, have the pro do it. Have the pro do the math
Yeah.
and tell you this is how much to feed so that, you don't go through that
No, and this mare never has
work.
an empty bucket. She has to eat all
Right.
soaked feed, but I go, her
Mhm.
bucket is never empty. I go, whatever
Mhm.
you will eat, you get. And so,
Sure, sure.
but anyways, that's it kind of gives a little bit of a segue into what we're going to talk about with ulcers, because I'm super curious about this conversation. One
Mhm.
of my primary objectives when I'm working with horses in training is to really help. I can't stand to see a stressed out horse.
Mhm.
And the whole first part of training that I call the learning frame of mind is really helping using a bunch of different, simple strategies, help the horse shift into dominance of the
Mhm.
parasympathetic nervous system
Mhm.
because it just has so many health benefits on top of
Right.
making the horse safer to handle and
Mhm.
easier.
Mhm.
So my experience, it was actually this same mare, only when she was gone for 2 weeks to have her colic
Mhm.
surgery, did she
Mhm.
develop an ulcer. And I've never had horses with ulcers. If they came in with ulcers, then we were trying to turn that around in training. So I'm really anxious to hear about ulcers from you because I know it's a
Right.
big deal in the horse business. It's actually, unfortunately, really common. I
It
just don't
is.
have a lot of personal experience with them.
Right. So I guess before we go into the conversation about ulcers, I should probably, for those that haven't listened to previous podcasts, just tell everyone a little bit about myself so they know where we're coming from.
Yep.
I am the case manager and on staff functional nutritionist for True North Equine Vet in Marshall, Virginia. I have worked as a veterinary technician for a little over 20 years now. And my formal education, as far as nutrition goes, is in human functional nutrition. And the reason I chose to go that route versus a traditional agricultural program is that when I was looking at the agricultural or animal programs, I found they were operating on science that's a solid 20 to 30 years behind the information we have for humans.
Mm.
So I take from the human side of things, what I know, the concepts and philosophies and things that I know we can apply to the animals, because I do more than just horses, I do dogs and cats as well. But to sort of get a little bit better, more long term results than the traditional agricultural based protocols. So,
Mm,
with that said, what comes from me is becoming more mainstream, but it's still not, the mainstream sort of thought process on how to approach things nutritionally, or how to approach things, from a functional medicine sort of standpoint. So it will be probably very different than what you would get from your conventional vet. There aren't very many vets out there who get a lot of nutrition education. So they're your first stop for diagnosis and potential treatment, but beyond that it really takes someone who's specialized in nutrition to help dig out the root cause of
hmm.
what's going on and how to support and heal from the inside out.
Yes.
Okay.
No, excuse me. The results always to me are what speak the greatest volume.
Mm-hmm.
And in the diet change I did after, doing the podcast with you, sort of put all the horses in the barn on this forage-based diet. And, one horse who had fat cankles his whole life and his hind fetlocks,
Mm-hmm.
that inflammation went down like immediately.
Mm-hmm.
Nobody else in my barn lost any weight on the diet change. It was
Mm-hmm.
just my one older mare. And
Mm-hmm.
it's easy to think, oh, she's old, she needs this senior feed. But if it
Mm-hmm.
hadn't have been all of this drama around her colic, I might have hesitated more. But watching her digestion clear up almost immediately was like, okay, I'm going to hang in there and just get weight on her with this new food.
Right.
But the
Mm-hmm.
results really speak for themselves, even if and it's not going to hurt horses to change
No.
to a forage-based diet. I go, the worst thing that's going to happen is they might lose a little weight. I go,
Right.
that's so
Right. And we can compensate for the weight loss.
exactly,
Mm-hmm.
exactly. So where do you
So,
start with ulcers?
well, I think it's important to understand, or for owners to understand, that ulcers is a very blanket term. And the term that used to be used for the longest time was equine gastric ulcer syndrome. And that is now not really the term to use. Sometimes people will use it as a blanket or umbrella term for stomach ulcers in general. But we actually have three specific and very different types of ulcers, and they all have their own little intricacies as far as what causes them and how we manage them. But ultimately, we can do things that help us manage or prevent all of them. So we don't have to necessarily focus on how to manage each individual one, but I think it's important information for people to understand the different types and why those diagnoses of each individual type are important. So we have equine squamous gastric disease. So those are your stomach ulcers that usually affect the upper half of the stomach. And then we also
Can
have
you,
equine.
sorry, can you spell that for me? Because I always like to take
Sure.
notes.
Squamous is
Squamous. Yeah, that's a tongue twister. Okay.
That's
Equine
okay. And
squamous
we'll,
gastric disease.
yes.
Okay.
And the names might make more sense once we go into the individual, like the specifics of each individual type. But I was just going to
Okay.
kind of run through the three different types that we have. So we
Okay.
have equine squamous gastric disease, and then we have equine glandular gastric disease. Those usually affect the lower half ish of the stomach and
That I can
potentially the
spell
clitoris.
too. Okay.
And then we have, of course, hindgut ulcers, which is the big, thing now. Everybody's talking about hindgut ulcers and how to deal with them and how difficult it can be, supposedly, to manage and or treat them. So we'll get into the specifics of those later on. But
Okay.
so squamous gastric disease, like I said, is probably the most understood. That's what we have the most information on. Years ago, when we started seeing these ulcer issues and really getting into looking at what's causing them and where they are and all of these things, our gastroscopes were much shorter than they are now. I think they used to be only about 2 to 2.5 meters, and now they're about 3 to 3.5 meters. So we couldn't really
Mm.
see to the bottom of the stomach. We could really only see like about that first half. So most of the information when you're Googling, or if someone's not specifying in what they're talking about what type of ulcers they are, they're usually talking about these squamous disease, the squamous gastric disease. So for the sake of keeping it simple for everybody, I may switch back and forth between squamous and ulcer, but try not to get confused.
Okay.
um,
So when we use the generic term ulcer, it's usually
mhm.
referring to the equine squamous gastric disease.
Yes. So those are
Okay.
the ulcers in like the upper half of the stomach.
Upper half of
Um,
the stomach.
so
Okay.
and I will reference a presentation and some studies that were done by a world renowned vet named Dr. Ben Sykes. And he has devoted many, many, many years to studying nothing but ulcers for the most part. And I'll make sure that you have the link that you can post to his presentation, because it goes really in depth to all of the science, whereas I'm just kind of touching this tip of the iceberg. But if
Okay.
you really want all of the good, the science and the studies and things, he has a really good presentation that's on YouTube that you can watch or listen to.
Oh,
So
excellent. I'll put that link in the show notes and the description box so people can access
yes,
it. That's great.
yes. So essentially, what causes the squamous gastric disease is a lack of forage. That's the keystone to preventing these issues. There isn't a whole lot of evidence right now that stress causes those ulcers. I think usually it's the other way around. We're not feeding enough forage, and then the horses get stressed because they have ulcers. So the ulcers usually come first, and then the stress comes after. Um, it's usually caused also by high carbohydrate, which is your grain based diets. That increases volatile fatty acids, which increases the potential for erosion of the squamous mucosa, which is the lining of the stomach. So that's where the
Ah,
squamous comes from.
got it.
So exercise can be another contributing factor, but it's not actually the intensity of the exercise for these squamous gastric disease horses. It's actually the duration. So how long you're riding, not necessarily the intensity.
And so is that
So anytime,
why when we suspect ulcers in a horse, like one of the ways I suspect it is they go off their grain. If they're on a grain-based diet, that's the first thing they quit eating if they have an
usually,
ulcer.
yes, and that can actually happen with all the types. But typically, yes, it will be these squamous gastric disease horses.
Okay.
So that's just, kind of an overview of the squamous cell. We'll get to the management part and,
Okay.
how to prevent them after we go through all of the types of ulcers. But those are what most people associate when they talk about ulcers, is the equine squamous gastric disease.
Okay.
So then we move on to equine glandular gastric disease, which is actually pretty poorly understood at this point as far as the science goes. They really hadn't even classified or started studying the glandular gastric disease until like right around 2016.
Mm.
So not very long ago. Usually that affects the lower half of the stomach. It's allegedly not a disease of diet, but I could make an argument that any disease is related to diet. I think it
Hmm.
still plays a role in destroying the natural protective barrier, because the lower half of the stomach is supposed to be soaked in stomach acid, which usually has a pH of about 1 to 2, which is very, very low. But I believe that the reason the protective lining and the protective barriers that are in place there are eroding or being destroyed is because of things that we are feeding, although the science doesn't say that yet. But I could make an argument for it.
Okay.
We
So
won't spend a whole lot.
what do they say is the normal cause of the glandular?
So they're saying that in the studies they've done, and this is primarily on thoroughbred racehorses in Australia and warm blood show jumpers in Europe. Those are the groups of horses that they were studying the most. They say that it's actually the number of days per week that the horse is working, regardless of the intensity or duration. So they think that's the primary cause. But they
That the
also
horse is
found
getting too much work or not enough work?
too much.
Too
So
much
they're
work.
finding that horses really need to have 2 to 3 days off per week, and that
Hmm.
that helps really prevent them from getting this glandular gastric disease. But they're not finding that intensity necessarily has anything to do with causing them. They think it's the number of days, whereas the squamous cell was um, not so much the intensity, but the duration.
Too long.
Right. Mm-hmm.
Okay.
They also found that the use of NSAIDs, so bute and equiox, were the two that they studied the most. That even at normally prescribed doses, so your standard dose of bute or equiox, in as little as 7 days, was actually causing these glandular gastric disease horses to have problems, or causing the glandular gastric disease in the horses. But they haven't found that it's related to H. pylori or a bacteria like it is in humans. So we
Okay.
can't apply the same concepts from humans that we can, to the horses. We can't use the same information.
Right.
Um, and there's growing evidence that stress does induce the glandular gastric disease, whereas there was not for the squamous.
I'm glad that's starting to become supported by science because it's one of those things that on a practical level, it's
Mm-hmm.
sort of a duh. It's like,
Right.
duh.
It is. It is. But I could make an argument that it's sort of a chicken before the egg sort of situation with the
Yes.
squamous
Well, it
cells.
becomes a
Or I'm sorry, the
downward
squamous
spiral because the more stress the horse is under, then if there's
cells.
pain from an ulcer, that's going to create its own cycle of stress. And so it becomes really
Mhm,
cyclical. And
mhm,
finding your way out of that, whether stress
mhm,
came first or the ulcer came first, I go, one's going to
mhm.
feed the other. It just
Right.
becomes a very fast
Vicious
downward
cycle.
spiral.
And actually, if you're coming from a functional medicine perspective, stress is a vicious cycle for any disease process, because
Yes.
disease is essentially caused by inflammation, and inflammation is fueled by stress.
Yeah.
So if the horse is stressed, it's going to cause more inflammation. If the horse is already inflamed, it's going to cause stress, and it's just this like never-ending cycle until you break both the inflammation and the stress patterns.
Yes.
So to me, what they're finding makes sense. But of course, I can always make an argument that one, diet affects everything, it's the foundation for all health. And two, stress causes a lot of problems. But which
Yeah.
comes first, it may be
Yeah.
dependent
No,
on.
I get it. And looking at sort of, ideal functional coordination in motion,
Mhm.
I
Mhm.
go, that's related to stress. That's related to the functions of all the systems of the body.
Mhm.
Because if you have poor movement or dysfunctional use of the body, you're creating discomfort and stress every single time you're working the horse. And so I get it. I go from my perspective too, but it all fits together. I go, that's
Right.
exactly as horse owners, there's so many different components to our horse's health and well-being that I really appreciate getting your perspective on it, because each perspective can do so much.
Mhm.
And it's not
Definitely.
always, sometimes it's the magic bullet, and sometimes it's
Mhm.
just one piece of a bigger puzzle.
Right. And it is a puzzle. And it usually does take a whole horse approach. And you can't just do one branch, or you can't just put one piece or two pieces together and expect that that's going to be your resolution for all things going on with your horse.
Exactly.
There's usually disease and lameness and things of that nature are usually symptoms of something deeper. And so you can throw drugs at or injections at anything and put a band-aid on it, but until we dig down for what are the compensatory patterns that are causing that lameness, what is the emotional connection for those compensatory patterns, or what is the disease process that's causing that horse to hold itself that way, you could go,
Or
it's
the
quite
horrifying realization that I was causing perpetual inflammation in my beautiful horse that I've owned her whole life. I was contributing to that unknowingly. And
Mhm.
the diet change really showed me that. And I was like, oh my God, we all have so much to learn.
We do. And we're kind of getting off topic, but at the
Yeah.
same time, I try to encourage folks not to beat themselves up, because we have, as a whole, and, remove myself, I haven't always known what I know now.
Me
I
either.
was in the conventional feed grain because that's what we were taught and told to feed. I grew up feeding my horses grain. I lost my childhood heart horse to a strangulation lipoma. And that's kind of what spurred me, down this road of, how do I never let this happen to anybody else's horse again?
Yeah.
When we know better, we do better. And
Yes.
so my goal is just to share what information I have so
Yes.
that people can just, one, start demanding better for their horses, because that's part of our problem right now is there's so much marketing and good marketing out there that makes people think that, the best thing in the world for their horse is to feed these grain based diets, when really that's so far from what they should be eating.
Mm.
It's unreal. But if we, as owners, we have the power because we're the ones that are paying for the feeds, right?
Yeah.
So if we start demanding better because we know more, because we're seeking out the knowledge and the education to say, my horse is sick and I don't accept that this is just how it is. And
Yeah.
we start asking for better feeds and, seeking out the knowledge that's out there, we have the power to change the industry. And that's kind of why I'm in this, is
Yeah. Me too.
to create a movement. It's not, of course, everybody needs to make a living, but it's more about creating a movement to help the horses
I'm
than it
with you,
is
sister. I got it.
anything, right? So anyway, that was off on a tangent that we got away from ulcers, but it was
It's like, I think it's important
important,
to
I think, to
say.
say.
Yeah.
Yes.
No,
So then
sorry,
go
go
ahead.
ahead. Let's get back
That's all
on
right. The
hindgut
last
ulcers.
type of ulcer that we have are obviously the hindgut ulcers, which are the ones that everybody's really sort of talking about and not sure how to manage, because they're coming at it from a very conventional, drug-based approach, but they're very easily managed if you're taking more of a functional approach. And we'll get to that, in a minute. But so hindgut ulcers involve the cecum, the large and small colon, and they're caused primarily by intermittent feeding, intense exercise, extended or frequent use of NSAIDs. So back to that butanamine, um, Equiox, although Equiox is supposed to be less harsh for the GI tract, but
Mm-hmm.
it taxes other organs in the body instead. Stress, so that's where our
Yeah.
stress really comes in.
Yeah.
And then a high carbohydrate, grain based diet, parasites, and the low pH that's caused by eating that high carbohydrate, high grain type diet. So symptoms for all of them really are a decrease in performance. So, for example, your mare not wanting to go forward could potentially be One symptom, loss of appetite and weight loss usually are also the major symptoms and complaints that we hear from people, in the at least in the practice that I work for.
And would you also, so like as a horse owner,
Mm-hmm.
recognizing symptoms of ulcers would be a decrease in performance.
Mm-hmm.
So they're not doing their job as well as they used to, or
Mm-hmm.
there's a perpetual training issue,
Mm-hmm.
loss of appetite.
Mm-hmm.
And would you say if it was a horse that was on like a package feed plus hay,
Mm-hmm.
if they lost their appetite, like typically I always suspected ulcers if they would eat their hay, but they wouldn't eat the grain.
Correct. So if they go
Okay.
off their grain, but they're still eating grass and or hay, usually that's a good sign that you're probably dealing with some degree of ulceration. And
Okay.
typically, now that we can see the whole stomach, the squamous and the glandular, I believe, are both graded on a scale of 1 to 4, based on the degree of erosion. But we still don't have a way to image the hindgut. So
Right.
we can't, scope to see whether there's ulcers in there. Usually, even in the practice that I work for stomach ulcers, we don't usually scope unless we suspect something's horrible, and then we'll refer it. But usually, we're just screening with the fecal succeed test, which is just a test you can either get from your vet or your vet can run in the field. That is a fecal test. They take a ball of manure and mix it with water, and they put it on this little kind of plastic slide, and within like 10 minutes or so the test will read whether or not it's foregut or hindgut. But usually that means they have to have actively bleeding ulcers
Mm,
for the test to detect. So grade 1 to 2 usually aren't actively bleeding. It's when you get to 3 or 4 that they start to bleed. So it won't detect the low grade ulcers. But even still, in the practice where I'm working, we we assume, for the most part, these sport horses in general, if they've either have poor top line or are thin and or they're not eating their grain but they're eating hay, we're just going to assume that they have some degree of ulcers, because for us, we're not using the conventional treatment as far as drugs to heal and prevent ulcers. We're using the diet, and so we're just going to change the diet regardless. So
right.
we save people a lot of money, not only in scoping the horses but also in like things like omeprazole and other drugs,
And
which
the
we'll talk about
treatments. Yeah.
in a minute. um,
So, as a horse owner, we could safely sort of maybe suspect if we had decrease in performance, loss of appetite, especially for grain, some degree of weight loss. And then we've also talked over and over about stress responses. And a
yes.
stress response could be high anxiety, but it could also be, like I talked about with Dr. Hancock, a dorsal ventral shutdown.
Yes,
And
absolutely.
so horses that are getting really shut down or really obviously anxious, or cranky. I go
Yes,
cranky is another
yes,
sign of stress. So any
yes.
of those sort of escalating energies in
Mhm,
behavior could
mhm,
also indicate, like putting those pieces together, you go,
mhm.
oh, I'm going to kind of guess that my horse might have ulcers. But you're saying we don't have to pay for the expensive scoping or take our horse to a clinic to get scoped, and that the treatment, the pharmaceutical treatments have to come through the vet, but you're saying there's some alternatives that wouldn't hurt our horse that we could adjust the diet and start
Right,
addressing potential
right.
ulcers.
And, just to clarify, I'm not saying that people shouldn't scope. I'm just saying you don't necessarily have to jump to that.
Hmm.
You can make some changes, especially if you're on a budget, because let's face it, most of us who have horses are on some
Yeah,
budget.
they're on a
So I
budget.
think the money is in those situations is better spent if you are on a budget and you don't really necessarily, I don't want to say care, but you're not You don't need the definitive picture from the scope to say, yes, they have ulcers, and you just want to try to make changes to help the horse to be healthier regardless of what's going on. I think it's better money spent to invest in the diet than it is necessarily to scope and or treat, especially with omeprazole. And I think it's important that we kind of have a conversation about omeprazole and why it's essentially the devil.
Well, and
it's
there's ulcer guard, there's gastro guard, and there's
Yep.
omeprazole. Those are the three most common sort of medications for ulcers.
So omeprazole is actually, so Gastrogard and UlcerGard actually are omeprazole. So they have
Oh,
omeprazole
okay.
in them. So
Okay.
when I say omeprazole, I'm just avoiding using the brand name.
Oh,
Okay.
okay. Because I
Um,
know that omeprazole was the generic version of
right.
Guard and GastroGuard.
Yep.
Okay.
So when I'm talking about omeprazole, I'm talking about what's called a proton pump inhibitor. And that is, as far as brands that people might associate omeprazole with, that would be your Gastrogard or your UlcerGard, which is kind of, it's been the go-to as far as treatment for ulcers for a very, very long time. But as Dr. Sykes talks about in his presentation, they have found that for a lot of reasons, omeprazole should not be used because has a lot of negative side effects, and we can kind of talk about the side effects. Obviously, this is a little bit outside my scope of practice, so always have a conversation with your vet before you
Hmm.
decide on what to use or what not to use. It's always a case by case sort of basis, and that's something that your vet should decide on. But I do think it's important for folks to understand that those drugs don't necessarily come without side effects. So you should have at least an understanding of how the drugs work and what they're doing in addition to what the label says they're doing, so you can make better decisions, when you're talking with your vet.
Do you mind jumping into that right now?
Yes. So
Okay.
with omeprazole, what that is doing is it's actually a drug that also gets used in people. And what it does is it coats the stomach and stops stomach acid production. So it doesn't slow it, it stops it. And unlike humans, horses are meant to be producing stomach acid 24 hours out of the day, 7 days a week at all times, because they are meant to be grazing and eating forage 18 to 21 hours out of the day. Okay.
Mhm.
So when we have a horse who is on omeprazole, it stops the stomach acid production so that the ulcers can heal, which works initially. But it also blocks calcium absorption, protein absorption, and other micronutrient absorption. So we're essentially, yes, healing the ulcers for the time being, but we're putting the horse in a situation where they're becoming chronically deficient if they aren't already deficient, which is usually what I find is the problem for horses who are developing ulcers, is they have some degree of micronutrient, which is the vitamins and minerals deficiency, as well as not enough forage. But when we stop that stomach acid production, if we're not weaning the dose of omeprazole as they're coming off of it, and also feeding something that still buffers the stomach as they're coming off the omeprazole, we end up getting what's called rebound ulcers. And so
Mm,
I call it the omeprazole carousel. So you get on this treatment of omeprazole, and then it seems like you can never get off it. Your horse is always having ulcer issues. You treat, they do well for a little bit, and then they have to go right back on because the
mm.
ulcers come back because we're not weaning and buffering, and the diet doesn't get addressed.
Changed. Right.
Yeah. So in humans, there's tons of studies that are showing that long-term or even periodic or frequent use of omeprazole is linked to an increase in fractures, bone fractures in people.
Mm,
And no one has really studied it to any degree in the horses yet. But if we think about all the thoroughbreds that are running at the track who are training, 5 to 6 days a week, they're high intensity, they're eating high carbohydrate diets, and then we see them breaking down at the track.
Mm.
Most of those horses are living on some degree of omeprazole, and we've seen a huge increase in fractures and
Sure.
breakdown at the track in even just the last 3 years, right? It's been all over the news. It's been
Hmm.
happening a lot longer than that, but there's an increase in it. And I think that's because of the omeprazole use and the fact that it blocks the calcium from being absorbed as well as other things. But I think as we start to study that more, I think we're going to link it to the same situation in horses.
Mm.
Um, so it's really no longer the gold standard. A lot of vets still reach for it. A lot of horse owners, because that's been for so long what we treat with, owners are reaching for omeprazole or ulcer guard, even in just short-term use, like to trailer to a show, and while they're at
Hmm.
the show, trailer back.
Right.
And that use is actually far worse. That intermittent short period of use like that is actually far worse than an actual treatment protocol where they're doing like 30 days
Hmm.
and then weaning, as long as they're buffering too and changing the diet, but weaning. That short term, like weekend long use where you're just using it and then stopping, you're not helping your horse. You're actually going to give them ulcers
Oh,
because you're
wow.
stopping the stomach acid, and then you're all of a sudden opening the floodgates, and so then it overproduces. So you're likely not getting the results that you think you are by using it short term.
Well, and I've only ever used it with a vet, and it's always
Mhm.
been a gradual come down with an increase of forage as they're coming down.
Yep.
And but I have to say, I think most of us as horse owners, without what you're saying or without this explanation, I've always thought of these as benign, sort of helpful medications for a horse, that
Mm-hmm.
it wasn't going to hurt them and it might help them. And I think a lot of people have that perception
Right.
because it's been so common for so long.
Mm-hmm. Mm-hmm.
Yeah.
Yeah, I think it is a common misconception that there isn't any drawback to using it. And it actually, there are so many reasons not to use omeprazole. So much so that the practice I work for, Dr. Hancock, who you've spoken to,
Mhm.
does not use omeprazole. We don't use it at all. We don't even carry it. I've been there for going on 4 years, and she hasn't ever prescribed omeprazole for anything.
Mm.
Um, the gold standard now, if you do need some sort of treatment intervention, is to use sucralfate and misoprostol. Um, and Dr. Sykes goes in depth into why those things work and why that's better than the omeprazole in his presentation. And since he's the vet, I'm going to let people
Yeah.
go reference his info versus me going into it. But you're not blocking absorption of anything with the misoprostol and the sucralfate. You're kind of putting a band-aid over the
The
ulcer so
pain.
that
Yeah.
so that there isn't the pain there and it
Right.
can heal. But you still, unless you change the diet, and I will make the argument that unless you change the diet for all of the ulcer horses, whether that's squamous,
Right.
glandular, or hindgut, you're going to struggle.
With
And
repetition of the problem.
right. And so that's kind of the conventional, diagnosis and treatment as far as a functional medicine approach, which is what the practice I work for
Hmm.
takes. We would start with diet and lifestyle changes. And then if we felt like they either weren't doing as well with just those changes or they needed a little more, then Dr. Hancock, either congruently or after the fact, would use the sucralfate and misoprostol to treat.
No, and that's good to know because I've had horses on sucralfate when they're on medications that are harsh enough to potentially cause ulcers. That
Yes.
sucralfate goes with the protocol for the meds. And
Mm-hmm.
that's really good to know because that's
Right.
actually worked great. I've rarely had to have a horse on the other types of ulcer medications.
Mm-hmm. And that's excellent. I usually don't cringe as much if someone says they're using sucralfate as I do when they say they're using omeprazole.
Yeah.
So, of course, the spotlight of what we're supposed to be talking today is how to manage all of
Yes.
those
So
things.
let's get
And because
into, because we're going on a long time with all our sidebars. So
yes, I
I mean,
know.
which is
So
fine
I will try to kind
because
of breeze
it's,
through that.
no, it's so
But
important and this is so educational. Thank you so much. And so for horse owners, like recognizing the symptoms, decreases in
uh-huh,
performance, loss of appetite, weight loss, signs of more stress, whether it's shutdown or kind of aggression or anxiety. And then
right.
if a horse owner says, "Oh wow, I've been feeding my horse grain for years," are like shifting to the forage diet. I get that. And is there anything extra to add to the forage diet? Do you or what do you want to start with? We could review the forage diet or look at
I think,
specific supplements that might address ulcers.
well, I think we probably should just briefly review the diet. So when you have a horse who has ulcers, you can make the forage based diet change yourself, but especially with horses who are already dealing with any kind of disease process, I usually recommend that you don't try to do it by yourself because you will get frustrated and you may run into issues that you're not sure how to deal with. And working with a forage based nutrition professional can remove a lot of that stress for both you and the horse. So
Okay.
I do and still encourage that. But for the horses that have ulcer issues, it is of the absolute utmost importance. If you did nothing else for your horse except make sure that it had hay 24 hours, 7, days a week, 365 days a year, never, ever, 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 ever running out, you would be going a very long way in helping your horse not only heal from those ulcers but also prevent them, right? We also want to make sure that if we are sport horse people and we are riding our horses, that they have some sort of forage based meal within 30 minutes before you get on. Okay, so they have something in their stomach when you're riding to sort of buffer and, I don't want to say suppress, but keep that stomach acid down in the lower half of the stomach so that you don't end up having ulceration in the upper half. So they
That's
always have
so
something to
interesting
work on.
because a lot of people tend to think they won't work their horse because they just ate.
Right.
And
And
I go,
that's
it's actually better if
backwards.
they just ate.
It
Interesting.
is. So usually for sport horse people, I recommend having hay in their stall available all the time, whether that means hanging a slow feeder net and just letting them eat as much of the hay as they possibly feel like eating. That's your best bet. But also you can feed them, a forage based meal of some sort, even if that's just like a soaked Timothy pellet with, you know, something in it that they
Mhm.
really like, whether that's apple chunks or carrots or something, just to get some more forage on their stomach before you ride. Excuse me, before you ride. I am a big proponent of a species appropriate, nutrient dense, real foods diet, which is always forage first.
Mhm.
I do not use alfalfa for a lot of reasons, but for ulcer horses in particular, it's starting to show in studies that it may not be as good for ulcers as we once thought. It actually, as it's being broken down, increases the volatile fatty acids in the hind gut, and that causes a dip in pH in the hind gut. So we're talking a little bit of acidosis. So people, the
Mm.
buzz, phrase is hind gut acidosis, right? So because of that, I don't use alfalfa for ulcer horses. I stick to the grasses like Timothy, Teff, Orchard, um, whatever grass happens to be
Mhm.
available, to you locally. Um, and then I round out, and particularly in these horses with ulcers, we need healthy fats. So whether that's like coconut copra, or I use Renew Gold, not the senior, but the original. There is another product out there called Maxi Glow. They're not necessarily the best options that we have available, but they're usually cleaner and easy for folks anywhere, at least in the US,
Yeah.
to be able to get a hold of. Um,
Yeah, I've
obviously
been
Europe.
using the Renew Gold has really helped my older mare put her weight back on.
Right, right. So it also, all the horses are bio individuals. So which one of those things you use is really dependent on the horse,
Hmm.
which is where working with someone who knows the products and understands, your horse's metabolism would be beneficial, because not all horses do well on Renew Gold, not all
Right,
horses do well on Maxiglow, not all horses do well on the Cool Stance, which is the coconut copra.
right.
Um, and then you just kind of round out that diet with a quality vitamin mineral. And I've kind of changed recently in the vitamins and minerals that I recommend the most. My favorite is by Horse Tech. It's called High Point Grass. And the other two that I use, um, one of them is a formula that I've formulated with Horse Tech, but they also have one called Lone Star Trace.
Lone Star Trace by
Mm-hmm.
also by Horse Tech.
Yes.
Okay. And those are the two you recommend the highest.
Or
Okay.
the one, like I said, the one that I make, but that would have to be, you'd have to contact me for that one if you wanted to go that route.
Oh, you got a
Um,
homemade mix that you sell.
right.
Okay.
It's still made by Horse Tech, but it's just kind of a custom blend for the deficiencies that I see most commonly. But the Lone Star and the High Point Grass are usually a pretty good off the shelf type supplement for most horses.
Okay, and I've
So
been using the Kiss Trace, which you recommended before, but do you recommend that still or
if the horses are doing well on it, I think
Mhm.
it's fine. I have moved more toward the products that have the B vitamins already in them, especially when we're dealing with metabolic issues or horses that have ulcers, because their gut is so unhealthy. I don't think they can make the B vitamins that they're
Oh,
supposed to,
got it.
um, as well. So I usually start with ulcer horses on a vitamin that has the B vitamins in it. And
Got
I
it.
also pay close attention to not only the amount of zinc, but the kind of zinc that is in the vitamin mineral. So you never want to feed a supplement that has zinc sulfate in it. It's the least bioavailable and it's actually quite inflammatory. So make sure you're reading your label if you're feeding something other than, the supplements that I recommend. Um, and I'm going a little quickly because I know we're running over on
Yeah, that's
time, but if
fine.
you need me to
Yeah.
slow down, let me know.
Nope.
Um, so we, beyond the diet, we obviously want to reduce stress. And that means increasing turnout time, thinking about, how long and how intense your workouts are, and limiting your ride days to, I would say, 4 days a week. But the study that Dr. Sykes did said, 4 to 5 days a week is probably the most any horse should be working.
Well, I'm going to interject as a trainer
Yeah.
because from my perspective, when I have a highly stressed horse,
Mhm.
working on sort of getting a horse to mentally connect with the human and become
Yes.
a trusted herd member with the horse. I'll
Mhm.
actually work horses for more time, more days of the week, but
Mhm.
very slowly. Lots of rest periods at halt,
Yes.
lots of walking time, not
Yes.
heavy, demanding fast time. But that
Yes.
bond with the human, if we look at work from a different perspective, if we look at work as a way to reduce stress, release
Mhm.
pent-up energy very slowly with a lot of thoughtfulness, right? So if our horse is distracted or panicky, redirecting our horse's attention to us as a source of safety can really
Yes.
help reduce the stress. And then long periods of walk is really
Yes.
one of the greatest health benefits to their system. That's how they're meant to move in
Yes.
nature.
And
And
doctors, go ahead.
yeah, because we provide food and water, our
Yeah.
horses are never really walking for long periods like they would in nature. And so if our
Right.
quote unquote work time involves that type of work, then I
Mhm.
say the more the better. But if it's stressing our horse to work or it's high cardiovascular work, or it's
Mm-hmm.
really demanding athletic performance work, then I would agree with you. So
Mm-hmm.
I just wanted to interject that.
And Dr. Sykes did in his studies find that the walk, regardless of how many days a week or how long you're walking, did not have an effect on decreasing, or at least did not have a dramatic effect on decreasing the pH of the gut.
Yeah,
So walking is, it is the one of the best things you can do for your horse. Everyone thinks they need to get on and trot and canter and jump
yeah,
and do all. You do not. You can have the fittest horse on the planet just by doing healthy, correct working walk, not,
oh
pokey
no, in
dough, but
fact, I'm starting to
using
show
themselves.
on my YouTube channel two horses that have had significant lameness issues. They've been
Yes.
restricted to working at the walk for years because if I
Mm-hmm.
trot or canter too much, they go lame. And
Mm-hmm.
their body development looks like they're in sport horse training. I go,
Yes.
so it all can be done at the walk because the muscle development is dictated by the skeletal coordination, not
Yes.
cardiovascular.
Right.
And if you have inflammation you're on
Mm-hmm.
top of poor coordination of the skeleton, it's
Mm-hmm.
just like you're going to have problems.
Right. Yes.
Uh,
Absolutely.
and a lot of times, just letting a horse walk on a lunge line for an hour, I go,
Mm-hmm.
people think it's too boring or they're not getting anything done. I find, just like us, the more they just move calmly, the more
Mm-hmm.
they think about finding comfort in motion. And they start
Mm-hmm.
to improve their balance and their use and their coordination themselves. You
Mm-hmm.
don't always have to be giving a gazillion eights. It's
No,
like
definitely not.
they just need to move because in nature, they'll move an average of 20 to 25 miles a day in search
Right.
of food and water.
Right. Which is where track systems come in.
Yes.
Not just when we're talking about metabolic horses, but when we're talking about all of our horses to encourage them to move. And I won't go down that rabbit hole. People can Google track systems and
Yes.
all of that good stuff.
It's
But
a good
and
system.
maybe that's a podcast for another day. Who knows?
Yeah.
But those are the best ways to be managing the horses, regardless of what type of you know disease process or ulcer process you are working with.
Yeah.
Is just being very mindful of your horse is a sentient being, and what you do with them and how you interact with them, and even as an owner, trainer, handler, barn owner, whoever's interacting with that horse, your energetic interaction with that horse is going to affect them on an emotional and psychological level. So making sure that what you're bringing to the barn is peaceful and something that you would want to be around.
Yeah. Yes.
That goes a long way in reducing stress. But then also, really, the diet is, I will argue, is the most important thing, regardless of what kind of ulcers you're dealing with.
Yeah. And then can you go over quickly, because this was also since our first podcast,
Mm-hmm.
I've become a label reader for
Right?
clients as well as myself, and
Yep.
only looking whether it's a supplement or a feed or anything, those ingredients that you want to stay away from.
Right. So what Kirsten's talking about is everybody gets stuck on labels on feeds and supplements that they're looking at the guaranteed analysis, and the companies want you to focus on the guaranteed analysis, and that talks about what vitamins and minerals and things are in it and the quantities. But what I teach owners to do is I don't care what's in that guaranteed analysis until I look at the list of ingredients of everything that's in that supplement or
Product.
feed or
Yeah.
whatever it is. If it's going in your horse's mouth, read the ingredients. And my top 5 ingredients to avoid are soy, conventional soy, wheat, corn, molasses, and canola. There are a lot of other things I avoid, but those are my top 5. If you can avoid those top 5 ingredients, you're doing your horse a lot of favors.
Yeah, it makes a
So then people,
huge difference.
yeah, and people ask me, well, then what do I feed? There's nothing left. Everything has those things in it. And the answer is you break it down, you keep it very simple. You take it back to the basics. a forage pellet. Avoid alfalfa, especially if you're dealing with ulcers. Um, but a forage pellet or cube, whichever is easiest for you, and a healthy fat like the ones we just talked about, and then a quality vitamin and mineral supplement similar to the ones that we just talked about. And usually, if you just do those three things, your horses don't need a whole lot more than that. If they're not thriving on just those changes, there's usually something else underlying going on, whether that's, Lyme disease or a metabolic condition
Right.
or something. There's something else going on. So that might be that you need the vet, for diagnostics and things like that, or it's just that you haven't quite gotten the balance of the forage and the fat right. And so that's when you would want to reach out to a nutritionist or a nutrition professional who's well versed in a forage based diet. And I am available for anybody in North America. If you want someone who's local, I know a few, various other practitioners who do this
Mm-hmm.
in other areas. If you want someone who's going to physically come to the barn, but I work remotely on horses literally all over North America. So I'm available if folks need me.
Great. And all of your contact information will also be in the description box and the show notes. So if you
Mhm.
guys want to get a hold of Stephanie, just look for the written part that goes with this podcast, and all of your info will be in there, as well as the link to Dr. Ben Sykes' lecture about
Yes.
ulcers, where he goes into
Yes.
even more detail.
Mhm.
But yeah, it was shocking to me looking at every single label of every supplement. Like the feed, I kind of knew you can't buy a feed without soy hulls and wheat midlands, like a
Right.
packaged feed. So I go, that's
Yep.
going to be in most of your packaged feeds. But it surprised me reading the ingredients of a lot of different types of supplements,
Mhm.
that there were those same ingredients in a lot
Yes.
of supplements. And
And
now my
even the ones.
horses are thriving
Yes.
on just the basic diet. I think the
Mhm.
only supplement I give them is some sea salt as an electrolyte because we get so hot
Mhm.
here. But it's like that's it.
Right. Yep. And it's amazing how many of the ulcer specific supplements have all of those inflammatory things that we know are causing ulcers. So it's just, it's very frustrating. And I don't want people to get discouraged. There are things that are clean and that are out there that you can feed.
Yeah,
It's just a matter of knowing what you're looking for and not trying to overcomplicate.
absolutely.
Mhm.
Absolutely. And I think too, one last note is that every horse seems to have a different type of inflammatory response. So,
Mhm.
like, I had some horses that would get puffy legs. I had another
Mhm.
horse whose skin absolutely cleared up within days of the diet
Yep.
change, who had had
Mhm.
itchy, horrible skin and was rubbing
Mhm.
herself raw. Her skin cleared up right away. My mare quit colicking. And it's
Right.
almost like every horse manifests the inflammation in a slightly
Mhm.
different and unique way, but you
Mhm.
can take it back to that root of an inflammatory response,
Yep.
especially to one of these five ingredients.
Mhm.
And just eliminating those ingredients and putting them on a forage-based diet cleared up a ton of problems that I didn't expect it to clear up.
Right. Right.
Because you're just reducing inflammation. So now I call it the anti-inflammatory diet when I
Yep.
tell people about it.
That's what it is.
Yeah. Excuse me. All right, so we better wrap it up. Any final words of wisdom you want to share about ulcers?
No, I think I've sufficiently overwhelmed everybody for the day.
This, yeah, this one may have to play over and over for people to get. There's a
Right.
lot of information you shared, and I am so grateful. So, and I'm grateful to you guys who joined us. I hope this helps you as a horse owner with the horse you love. And thank you for joining us for another episode of the Horse Geeks podcast. Thanks, everybody.
Thank you.
Bye bye.